physically active, making positive changes to our diet really can help to reduce our risk of coronary heart disease. Eating healthily helps us to lose weight, and we know that being overweight or obese longer term increases our risk of heart disease. We also know that it makes us more likely to get type 2 diabetes as well. Having a good diet helps us to lower our blood pressure and also helps lower cholesterol levels, both of which are risk factors for coronary heart disease. So we've spoken about primary prevention, but actually your diet is equally important if you've already been diagnosed with a heart problem. What we really need to do here is to mitigate any ongoing risk factors. So for example, if you're overweight, trying to achieve a good weight for your height, looking at your lipid profile. So for example, if your LDL, what we refer to as bad cholesterol in the blood, is too high, how can we bring that down? Thinking about your blood pressure and reducing that if it's too high. And if you're diabetic, making sure that you maintain good blood sugar control. We should all be trying to reduce the amount of fat, salt and sugar in our diet. If we drink alcohol, we should take it in moderation, and we should try to increase the amount of fibre, fruit, vegetables and salads. Very simple, very clear. And actually the best advice is probably to follow a diet as similar to the Mediterranean diet as possible. What isn't so clear is the daily media messages about what we should all be doing to improve our health and well-being. So for example, should we now be trying to eat 7 portions of fruit and veg instead of the 5 that we've all been told? Should we be eating saturated fat? Is that okay? And is actually sugar the real thing to be concerned about? If we want to eat eggs every day, is that okay? All of these questions come up and it's confusing. It's not surprising that we all feel confused about what is the best thing to do right now. Your dietitian will follow evidence-based practice and work with you to cut through all of that information to come up with a lifestyle plan that's going to suit you. We've spoken about the importance of diet in terms of primary prevention of heart disease, and we've also spoken about the importance of secondary prevention and mitigating risk factors for patients with heart disease. Your state registered dietitian is clinically qualified, uniquely qualified to work with your medical team to look at your individual risk factors. With that information, they'll work with you to assess your dietary intake and come up with a tailored plan that isn't just a diet that you follow for a couple of days or a couple of weeks. These are lifestyle changes that will be helpful for you, but also for your family. You can ask your GP or your hospital doctor to refer you, and it may well be possible to have an appointment on the National Health Service. If you'd like to see a dietitian via the Keyhole Heart Clinic, then please give us a call or send a message through the website and we'd be delighted to assist you.